This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I'm Tanvi Taneja and with me is Sunil Verma. The headlines. Over 21,000 relief camps set up in various states and union territories to feed migrants and poor. Government intensifies cluster containment strategies and rigorous contact tracing as COVID-19 hotspots increase in the country. Delhi Police registers case against Maulana Saad and others of Nizamuddin Markaz for violating government's directions on lockdown. No shortage of medicines to combat the outbreak, says Chemical and Fertilizers Ministry. Lifeline Udan flights supplied over 15 tons of essential medical supplies across the country. And government ordinance extends various time limits under Taxation and Benami Acts. Joint Secretary in the Home Ministry, Punya Salila Srivastav said over 21,000 relief camps set up in various states and union territories. The camps will provide shelter to over 6 lakh people during the lockdown in the wake of the COVID-19 outbreak. Briefing media in New Delhi yesterday, she said facilities have been set up to feed over 23 lakh people and these are available to the poor, stranded migrant workers, quarantined workers and other needy people.
लॉकडाउन का एनफोर्समेंट स्टेट्स और यूटीज में संतोषजनक रूप से चल रहा है। एसेंशियल सप्लाईज की स्थिति भी संतोषजनक है। जो हमें राज्य सरकारों और यूटी से जानकारी प्राप्त हुई है उसके अनुसार लगभग स्टेट्स और यूटीज में लगभग 21,064 रिलीफ कैंप सेटअप किए गए हैं।
The government is using cluster containment strategies and doing rigorous contact tracing in COVID-19 hotspots to check the virus from further spreading. Joint Secretary in the Ministry of Health, Love Agrawal, said with over 1,200 cases of COVID-19, the number of hotspots in the country has increased.
उसके साथ ही अगर किसी पर्टिकुलर एरिया में ज्यादा केसेस आते हैं तो हमारा कंसंट्रेशन उस पर्टिकुलर एरिया में नेचुरली और ज्यादा बढ़ जाता है। इसके साथ ही जैसे पिछली बार भी मैंने आपको बताया था, ये भी एक बहुत डायनेमिक फिगर है। मान लीजिए कि अगर हमारे को शुरू में 2 या 3 केस केरला में मिले थे, उन केसेस को हमने कॉन्टैक्ट ट्रेसिंग करके प्रॉपरली मैनेज किया और उस पूरी चेन ऑफ ट्रांसमिशन को समझते अगर हमने उसको क्लोज कर दिया तो हमारे लिए वो जगह हॉटस्पॉट नहीं रहती। अब की सिचुएशन में जब हमारे यहाँ पर, तो आप समझ सकते हैं कि हमारे नंबर ऑफ हॉटस्पॉट्स उसी एक्सटेंड में बढ़ गए हैं और उसी एक्सटेंड में कुछ एरियाज में जहां हमारा एक्शन कंप्लीट हो जाता है, जहां पर कि हमारा 28 दिन का चेन ऑफ ट्रांसमिशन का मॉनिटरिंग भी कम हो जाता है और हमें लगता है हमने उसको कंट्रोल कर लिया, तो हम उनको हॉटस्पॉट की स्थिति से बाहर निकाल लेते हैं।
Mr. Agrawal said 227 fresh confirmed cases of novel coronavirus or COVID-19 have been reported in the past 24 hours in the country. With this, the total number of cases has now gone up to 1,251. 3 deaths have been reported in the last 24 hours, 1 each from Gujarat, West Bengal and Madhya Pradesh. He also informed that the government has formed an empowered committee led by Dr. Vinod Paul, member Niti Aayog, and Professor K. Vijay Raghavan, principal scientific advisor to the Prime Minister, which will focus on research and development and coordinate with various scientific agencies, regulatory bodies, private industry to work on countering COVID-19. He said 101 people have been cured and discharged. Dr. Raman R. Gangakhedkar of the Indian Council of Medical Research, ICMR, said over 42,000 samples have been tested so far. He said 123 labs are functional and 49 private labs have been given clearance. He informed that 399 patients have been screened in private labs yesterday.
अभी तक हम लोगों ने 42,788 सैंपल्स टेस्ट किए हैं। कल 4,346 सैंपल्स टेस्ट हुए, विच रिप्रेजेंट्स 36% ऑफ आवर कैपेसिटी। अभी इस वक्त 123 लैब्स फंक्शनल हो चुके हैं। प्राइवेट लैब्स में 49 लैब्स को परमिशन दे चुके हैं और कल प्राइवेट लैब्स में 399 पेशेंट्स की जांच हो चुकी है।
Dr. Raman R. Gangakhedkar informed that ICMR is working with the Department of Biotechnology and Council of Scientific and Industrial Research, CSIR, on the agenda of developing a vaccine for the COVID-19 disease.
The Delhi police has registered a case against Maulana Saad and others of Nizamuddin Markaz. The case was registered for violation of government directions given to the management of Markaz of Basti Nizamuddin. The directions ordered restrictions of social, political and religious gatherings and taking safety measures for prevention and treatment of COVID-19 viral infection. Home Secretary Ajay Bhalla has said that strict action, including blacklisting, will be taken against those who violated visa rules and travelled to India recently. He also said that FIRs will be registered against those spreading rumours related to COVID-19. The government has said that it is committed to identify, isolate and quarantine COVID-19 positive Tabligh Jamaat workers in India post their congregation in Nizamuddin, Delhi. The Home Ministry had shared details of Tabligh Jamaat workers in India with all states on 21st of this month after COVID-19 positive cases surfaced in Telangana. By Sunday, nearly 162 Tabligh Jamaat workers were medically screened and shifted to quarantine facilities. State police will examine visas of all these foreign workers and take further action in case of violation of visa conditions. Instructions were also issued by Home Ministry to Chief Secretaries and DGPs of all states as well as Delhi Police Commissioner.
In Telangana, 15 more people tested positive for coronavirus yesterday. All of them attended the Tablighi Jamaat congregation in Delhi. With this, the active COVID-19 cases in the state has gone up to 77. The government also appealed to all those who returned from their Tablighi event along with their family members and close contacts to report for medical tests. The state government has estimated that over 1,000 people from the state attended the event. Following death of 6 people, the state government has launched a massive search operation to find out those people who attended the Markaz event in Delhi and returned back to various districts. Over 700 people with COVID-19 suspected symptoms have been sent for isolation so far. Bihar government has prepared a list of 146 persons who had attended the Tablighi Jamaat event in Delhi. Additional Chief Secretary Amir Subhani said DMs and SPs have been instructed to locate these persons. Addresses and mobile numbers have been given to district authorities to track them. AIR correspondent reports instructions have been issued to ensure testing and self-quarantine of the persons concerned. In Gujarat, the state government ordered a probe to trace the identity and locality of people who attended the gathering at Markaz Nizamuddin from the state. Our correspondent has more.
Gujarat police said from Surat alone as many as 76 persons had attended the gathering. Surat Municipal Commissioner Banchnidhi Pani said the identity of 72 persons has been traced and efforts are going on to trace the rest 4. He urged people to voluntarily come forward. The Bhavnagar police had also swung into action to identify the attendees from the city. Meanwhile, 74 cases for COVID-19 were reported in the state so far. Various organizations and individuals are coming forward to join the fight against COVID-19. Prime Minister Narendra Modi's mother, Hiraba, yesterday donated Rs 25,000 from her personal savings to PM Care Fund to fight against coronavirus pandemic in the country. Aparna Khun, AR News, Ahmedabad.
The Chhattisgarh police identified 101 people who attended the congregation of Tablighi Jamaat in Nizamuddin Markaz in Delhi. The district administration quarantined and home isolated them after a massive search across the state. 69 identified people are home isolated while 32 others have been quarantined. People from various districts of the state attended this program. Meanwhile, the Chhattisgarh government is taking many steps to prevent the spread of COVID-19.
The government has said that there is no shortage of medicines in the country to combat COVID-19 outbreak. Chemical and Fertilizers Ministry said the Department of Pharmaceuticals is continuously monitoring the production of medicines since the outbreak of coronavirus in China. It said all efforts are made to ensure production of drugs and medical devices during the period of lockdown. The ministry said the department is also addressing issues of availability, supply and local related issues of medicines with the help of other departments and states and union territories. The ministry said a central control room number 011-233-89840 has been set up by the department, which is working from 8 a.m. to 6 p.m. National Pharmaceutical Pricing Authority has also set up another helpline number 1-800-111-255, which functions round the clock. The control rooms deal with issues related to coordination of transport and other logistic services related to drugs and medical devices. The Indian Institute of Technology Kanpur is working on portable ventilator to tackle the COVID-19 outbreak in the country. The prototype of this ventilator will be ready soon, and just after assembling, it can be used as life support system. More from our correspondent.
Ventilator is a very important medical equipment for COVID-19 patients, especially those who are old and the virus can prove fatal to them. Keeping this in mind, Bioscience and Bioengineering Department of IIT Kanpur has prepared a design of lifesaver portable ventilator. A team of experts from IIT is working for early production of this portable ventilator. Professor Amitabh Bandyopadhyay told AIR that there will be need of thousands of portable ventilators in future to strengthen the health system of country.
हमारे मैकेनिकल इंजीनियरिंग के प्रोफेसर्स हैं, टेक्निकल एडवाइस दे रहे हैं और उधर से डॉक्टर दीपक पद्मनाभन नारायण हृदयालय बेंगलुरु का जो कि मेडिकल इनपुट दे रहे हैं, ये सब इनपुट लेके हमारे इंक्यूबेटेड कंपनी निखिल कुरेले और हर्षित राठौर द्वारा नोका रोबोटिक उन्होंने ये डिजाइन बना लिए हैं. अब उनको सिर्फ असेंबल करके ये बनाना है.
Professor Amitabh said that in 1 month we will be able to produce maximum number of ventilators to save the lives of general public. With Rajesh Srivastav from Kanpur, this is Sushil Chandra Tiwari, AIR News, Lucknow.
Meanwhile, the Chief Minister of Uttar Pradesh, Yogi Adityanath, has said that strict action will be taken against those who did not reveal their illness to the health authorities. Talking about the Markaz event in Delhi, he said that around 95% of the people who returned from Delhi event have been identified. Only 10 to 12 people are yet to be identified, for which instructions have been issued to all the district magistrates and CMOs. Meanwhile, state government has started distribution of free ration from today morning at all PDS shops in the states. Distribution of ration started today from 6 a.m. and it will continue till 9 p.m. Antodaya and BPL card holders, along with Manrega workers and registered labourers, will get free ration. 101 cases have been reported in 15 districts, of which Gautam Budh Nagar and Meerut reported the highest number of corona-positive patients, where over 50 people are infected. A total of 14 people have fully recovered so far in the states. This is All India Radio bringing you a special program on COVID-19. Let's take a look at the headlines once again. Over 21,000 relief camps set up in various states and union territories to feed migrants and poor. Government intensifies cluster containment strategies and rigorous contact tracing as COVID-19 hotspots increase in the country. Delhi police registers case against Maulana Saad and others of Nizamuddin Markaz, violating government's directions on lockdown. No shortage of medicines to combat the outbreak, says Chemical and Fertilizers Ministry. Lifeline Udan flights supplied over 15 tons of essential medical supplies across the country. And government ordinance extends various time limits under taxation and Benami Acts. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
As part of India's war against COVID-19, the Ministry of Civil Aviation has launched Lifeline Udan flights for movement of medical and essential supplies across the country and beyond. Under the initiative, 62 Lifeline Udan flights have been operated during the 5-day period from 26th to 30th of March, transporting over 15.4 tons of essential medical supplies. 45 out of the 62 flights have been operated by Air India and Alliance Air. The carriers involved in the Lifeline Udan operations include Air India, Alliance Air, Indian Air Force and Pavan Hans. The Lifeline Udan flights are planned using a hub and spoke model. Cargo hubs have been established at Delhi, Mumbai, Hyderabad, Bangalore and Kolkata. Special focus has been on the northeastern region, island territories and the hill states. On the international front, Air India has established a cargo air bridge between India and China. Regular cargo flights for transporting critical medical equipment and supplies between the two countries are likely to be operated by Air India from 3rd of April onwards. The government has extended the existing Foreign Trade Policy 2015 to 2020 for 1 year till March 2021 amid coronavirus outbreak and the lockdown to contain the virus spread. The Directorate General of Foreign Trade, DGFT, in a notification said the existing Foreign Trade Policy 2015-20 which is valid up to March 31st this year, is extended up to March 31st, 2021. Various other changes are also made, extending the date of exemptions by 1 year and extending the validity of DFIA and EPCG authorizations for import purposes. Exports during April to February this fiscal dipped by 1.5% to $292.91 billion. Imports during the period declined by 7.3% to $436 billion, leaving a trade deficit of $143.12 billion.
Public sector banks have announced deferment of EMI payments on loans to customers for 3 months in the wake of COVID-19 pandemic. The RBI had earlier issued directions asking lending institutions to allow 3-month moratorium on loan payments. Banks like State Bank of India, Punjab and Sindh Bank, Canara Bank, UCO Bank, Syndicate Bank and Bank of Baroda have announced the offer of the moratorium to customers via tweets. SBI said in its Twitter handle that they have initiated steps to defer the installments and EMIs on term loans falling between 1st of March and 31st of May. It said the interest on working capital facilities for the period has also been deferred to 30th of June. Canara Bank is further providing collateral and margin-free loans up to 20 lakh rupees to self-help groups. The Vaishno Devi Shrine Board today denied rumours that around 400 pilgrims are stranded at Vaishno Devi Temple. The board clarified that no devotee is currently stranded in Katra or at Vaishno Devi Shrine. According to CEO Shri Mata Vaishno Devi Shrine Board, Ramesh Kumar Jangid, the pilgrimage was suspended on March 18th, days before the 21-day lockdown was imposed in the country. Jammu-Srinagar National Highway continues to remain blocked for the 6th consecutive day today. This blockade has resulted into disruption of the movement of essential supplies to Kashmir Valley. Authorities are making efforts to restore the highway to ensure supply of essential commodities. More from our Srinagar correspondent.
Because of the continued closure of the national highway between Jammu and Srinagar for the 6th consecutive day today, Chief Secretary BVR Subramaniam has directed the National Highway authorities to put in more man and machinery so that the highway is opened for vehicular traffic and almost 2,000 standard trucks carrying essential supplies reach Kashmir Valley. The Chief Secretary also took stock position of the essential commodities in Kashmir Division and has directed Secretary Food, Civil Supplies and Consumer Affairs to prioritize essentials in case the need arises to supply the commodities to Kashmir through air service, keeping in view the prevailing lockdown in Kashmir. Sunil Koul for AR News from Srinagar.
Himachal Pradesh state government offices and educational institutions will remain closed till 14th of April in order to contain the spread of COVID-19. Our correspondent reports that control rooms have been set up and made functional in all the districts of the country so that anyone in need can call for help.
In a high-level meeting, it was decided that all the government offices, educational institutions, Anganwadi and creches shall continue to remain closed till the 14th of this month. Movement of public and private stage and contract carriages, including taxis within and from outside the state, have also been restricted till 14th April. Permission to ply private vehicles will be allowed only in case of visiting the hospital and for availing maintenance of essential services. On the other hand, the control room has been set up to coordinate with the people stranded in the other state. To facilitate the people of Himachal Pradesh stranded at different places, control rooms have been established at Himachal Bhavan, Delhi and Chandigarh. Meanwhile, Chief Minister Jairam Thakur said that 17 people from the state who were on the religious congregation at Delhi Nizamuddin have been quarantined in Delhi for 14 days and have no symptoms of COVID-19. Sanjeev Sundariyal, AIR News, Shimla.
Karnataka has harnessed technology to galvanize its efforts to counter COVID-19 pandemic. The 10-member task force on COVID-19 is utilizing IT applications, GPS and mobile app to track individuals suspected of the virus infection. More from our Bengaluru correspondent.
The task force on COVID-19 pandemic will be using Corona Watch mobile app to keep track of quarantined persons. Quarantined persons have to declare the location every hour during the 14-day period. If someone fails to share the location, then the police and quarantine enforcement team are mandated to visit such a home quarantined person and put him in government quarantine institution. This location detail, which is geotagged with date and time, will be available to public and they can avoid going near the quarantined persons. The Secretary, Administrative Reforms and Member member of State Task Force for Containing COVID-19, Munish Maudgil, spoke to AIR about the IT applications being used by them to combat coronavirus.
The tracking of all of them manually on a paper is very, very tedious and not possible. So technology will help in tracking these people by logging the details of them. Any person you come in close contact with, technologically we'll be able to know from the app.
The task force is using software and data from telecom service providers to get information on any person who is in touch with a quarantined person. Sudhindra, AIR News, Bengaluru.
Kerala strengthens its fight as more COVID-19 cases are getting confirmed in the state. A report.
7 more COVID-19 positive cases are confirmed in Kerala last evening. The total number of patients under treatment in the state is 215. More than 1,63,000 people are under observation in the state. 658 people are in hospital and the rest are in home quarantine. Chief Minister Pinarayi Vijayan said that there will be an exclusive and special project for Kasaragod, which is the worst hit district with large number of COVID-19 patients. Free ration distribution will begin from today in the state. For people who cannot come in person to collect the ration, the same will be provided at their home. Mr. Vijayan further said that the government will take all measures to contain inflation. Mayusha for AIR News from Thiruvananthapuram.
The government has brought in an ordinance to give effect to various relief measures related to income tax and GST compliance in view of COVID-19 outbreak. It provides for extension of various time limits under the Taxation and Benami Acts. The ordinance also provides for extension of last date for filing of original as well as revised income tax returns for the financial year 2018-19 to 30th June. The ordinance provides for the same tax relief to Prime Minister's Citizen Assistance and Relief in Emergency Situation Fund, PM CARES Fund, as available to Prime Minister National Relief Fund. Donations made to the PM CARES Fund shall be eligible for 100% deduction under Section 80G of the IT Act. The limit on deduction of 10% of gross income shall also not be applicable for donations made to PM CARES Fund. The date for claiming deductions under Section 80G, including donations for the fund, has been extended up to 30th of June. In the wake of growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress preventive measures like social distancing, personal hygiene, and restriction of mass gatherings. A report.
Government has said that there is enough supply of essential items and people need not worry and rush to marketplaces. People are advised to have patience and keep calm while shopping for essential goods and medical supplies. Frequent trips to buy essential items should be avoided and people should refrain from shaking hands and hugging as a matter of greeting. At least 1 meter distance should be maintained by people at marketplaces, medical stores and hospitals. Non-essential social gatherings at home should be avoided and visitors at home should not be allowed. People should not touch their eyes, nose and mouth, and frequent hand sanitation is a must. Both sides of hand have to be washed for at least 20 seconds. If a person is experiencing cough and fever or any other symptoms, he or she should avoid close contact with others and doctor should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public for enquiry about coronavirus. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
In our segment on Mythbusters, Dr. Srinath Reddy, President of the Public Health Foundation of India and former head of the Department of Cardiology in AIIMS, New Delhi, highlighted the importance of hand washing and personal hygiene as a precaution against COVID-19. Speaking to All India Radio, he said that such steps are essential to prevent the virus outbreak.
पानी से वायरस बैठ जाता है हाथों से और साबुन में जो कुछ फैट्स होते हैं ये वायरस का फैट कोटिंग को हटा देता है और वायरस को नाकामयाब बना देता है। तो ये जरूरी है कि हम हाथ धोएं। साबुन भले ही ना इस्तेमाल करें, पानी के साथ हाथ धोना बिल्कुल आवश्यक है, मगर साबुन से धोएं तो और भी बेहतर है।
Actor Gulshan Grover urged everyone to stay at home and follow all government directions during the lockdown.
सभी को मैं रिक्वेस्ट करता हूँ, आपकी गवर्नमेंट, आपकी अथॉरिटीज सब कुछ आपकी भलाई के लिए कर रही है। फॉलो ऑल द रूल्स, स्टे एट होम।
Actor Raveena Tandon urges people to stay at home during the lockdown and suggested various ways of spending time at home.
और मेरी आपसे अपील है कि इस वक्त सुरक्षा बहुत जरूरी है। इसीलिए जरूरी है कि आप और आपका परिवार घर पर ही रहें। हम घर पर रहकर किताबें पढ़ सकते हैं, फिल्में देख सकते हैं, घर के बच्चों के साथ खेल खेल सकते हैं और बच्चे भी ऑनलाइन ऐप के जरिए पढ़ाई कर सकते हैं। बड़ों के साथ बैठकर कहानियां सुनिए, बड़ा मजा आएगा। प्लीज चिंतित मत होइए। जो आपके रोज की सुविधाएं हैं, जैसे किराने की दुकान और दवाइयों की दुकान, वो लगातार खुली रहेंगी। अपने गवर्नमेंट और एडमिनिस्ट्रेशन की सुनिए। प्लीज बी सेफ, प्लीज स्टे एट होम। यही हमारी आपसे विनती है।
In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Dr. Anjan Trikha, Professor Anesthesiology, AIIMS, suggested to people to stay at homes to keep themselves away from coronavirus infection.
Some people who will get infected by coronavirus may land up into an ICU if their condition deteriorates. It is better to stay home for 21 days and not get admitted to an ICU.
Dr. Purva Mathur, Professor Lab Medicine, AIIMS, has said that social distancing is very important to check the spread of virus.
The coronavirus spreads by droplets when a person coughs or sneezes. These droplets do not travel beyond 1 meter, and that is why it's important to maintain social distancing.
For listening to other medical experts, tune in regularly to our bulletins.
President Donald Trump has said that the U.S. is headed for a tough 2 weeks in the fight against COVID-19. Speaking at a news conference yesterday, he advised people to be prepared for the hard days ahead. President Trump added that the U.S. is going to start seeing some real light at the end of the tunnel. He appealed to the American people to be positive and cooperate in this war against the invisible army of coronavirus. He added that the COVID-19 crisis is unlike anything the U.S. had ever faced. President Trump also said that success in this fight would require the full absolute measure of our collective strength, love and devotion.
More than 40,000 people have been killed in the coronavirus pandemic across the globe, with the U.S. bracing for its darkest hours after its death toll surpassed China's yesterday. In a matter of months, the virus has infected more than 8 lakh people worldwide in a crisis, redrawing political powers, hammering the global economy and transforming the daily existence of some 3.6 billion people who have been asked to stay at home under lockdowns. Deaths shot up again across Europe yesterday as Spain, France and Britain reported their deadliest days. More than 800 died overnight in Italy and Spain. Meanwhile, the US, which has the highest number of confirmed infections, reached a bleak milestone as deaths topped 3,400, ticking past China's official tally of 3,309, according to a Johns Hopkins University tracker. France joined it with a surge to 3,525 deaths.
And now an overview of today's newspapers covering COVID-19 stories. The Tablighi Jamaat event in Delhi's Nizamuddin area, emerging as the single biggest source of COVID-19, gets major focus on the front pages of newspapers today. Tablighi meet turns Corona super spreader. Headlines the Mail today. The Indian Express writes, across nation, a race to trace contacts of Tabligh meeting. The paper adds, alarm bells ring in 20 states and union territories, 50 test positive in a single day in Tamil Nadu. The Hindu reports, officials of Tablighi Jamaat charged with defying restrictions. The Tribune says foreigners who were at the Jamaat to be blacklisted. The ICMR playing down the signs of community transmission in India gets highlighted by several dailies. As US deaths cross 3,400, ICMR compares infection probabilities low in India, reports the Indian Express. Quoting a government study, the Tribune reports that once 80% of population wears masks, outbreak of COVID-19 can be stopped immediately. According to a story published in the Hindustan Times, the Indian Navy has developed an innovative ventilator design that can cater to 6 patients simultaneously. And finally, quoting a UN trade report, the Business Standard writes, India and China may escape global recession that is likely due to the coronavirus pandemic worldwide.
And now, before we end the special news program on COVID-19, here are the headlines once again. Over 21,000 relief camps set up in various states and union territories to feed migrants and poor. Government intensifies cluster containment strategies and rigorous contact tracing as COVID-19 hotspots increase in the country. Delhi police registers case against Maulana Saad and others of the Nizamuddin Markaz for violating government's directions on lockdown. No shortage of medicines to combat the outbreak, says Chemical and Fertilizers Ministry. Lifeline Udan flights supplied over 15 tons of essential medical supplies across the country. And with that, we end the special news program on COVID-19.